Good morning. It is 10 o'clock and it is time for our weekly coronavirus update. I'm sorry, I don't have my... I apologize. I didn't have things on and things sounded so quiet. It is 10 o'clock indeed. I will repeat myself again. Welcome to our weekly coronavirus update. We are really happy to see you all again. Today we're going to talk about behavioral health and how we need to take care of our own mental health. So let's make sure that the mic stays muted. We actually have decided to take control of that. So if you need access to a microphone, please message a meeting host, and you will be able to see that by looking at the participant list. You'll see who is a host. But specifically, I think you can just say Justin chat. Please use respective language if you want to talk. If you are concerned about your health, call us at 588-4340, or you can call the Kentucky COVID-19 hotline at 1-800-722-5725. And if you have any question during this time, please, during the whole call, please do that in the chat. If you have any sound issues, you can just click on that little arrow there that you can see. That will help you handle that one. And then next slide. Please type again, as usual, the name of the county in the chat so that we can see our reach. We appreciate that. And I think with that, I am going to ask Dr. Furman to give us the weekly update.
Hi, everybody. This is Dr. Christian Furman. I'm the medical director of the Traeger Institute in the Optimal Aging Clinic. I'm sorry I haven't been here for the last 3 weeks, so I've been on hospital service at U of L Hospital, but I really appreciate Dr. Laura Morton who gave the updates. So today I just want to let you know kind of the numbers. The governor puts it out on their website daily, and then he is now having a weekly conference call. It's going to be this Thursday at 4 will be the weekly call for the week. But Jefferson County has 4,173 cases and 200 deaths. And the whole state of Kentucky at 17,152 cases and 593 deaths. And July 4th and July 5th, there were no deaths. And yesterday, Monday, July 6th, there were 8 new deaths. And 2 were in Fayette County, a 100-year-old and a 103-year-old. And then Hopkins County was a 72-year-old. But in Jefferson County was a 51-year-old, an 89-year-old, and a 90-year-old. Nelson County, an 88-year-old, and Shelby County, a 96-year-old. So definitely older adults are the ones that actually die of coronavirus. I mean, anybody can die of it, but the statistics show that older people are the the highest category of deaths. So we just want to continue to be vigilant, and this is what the governor said, and I think it's true, that we want to honor these people that died by recommitting ourselves to keeping each other safe. So to be safe, we need to wear a mask. It's hands, face, space. So hands, wash your hands with soap and water or with sanitizer for 20 seconds. So it's hard. You really have to count to 20. Face, wear a face mask. Don't touch your face. And space, stay 6 feet apart for sure. Don't go into large gatherings. So the other big thing is U of L Health. When I was on the hospital service the last 2 weeks, they used to have, a hospital ICU unit of COVID and a non-ICU unit of COVID. And now at U of L Hospital, there's just one unit, ICU level people and non-ICU level people, because they just don't have as many. So for all of U of L Health, there's 27 patients, but that's Jewish, U of L, Mary and Elizabeth, all the different hospitals. So I think at U of L Hospital, it's only like about 7 to 10 patients. So it's good that Kentucky, if you look at a map, I mean, on the news on the weekend, they had a map of the whole state of Kentucky, the whole United States, and Kentucky, New Hampshire and Connecticut were the only green states. So, we're the only ones where we're not having a spike, which is great. So the other big news is the nursing homes are now opening up, and the personal care and assisted living have already opened up. And then July 15th will be all the nursing homes are opening up. And it's just so hard. The nursing homes are between a rock and a hard spot. They want to open up, but then they're also the highest risk and how to do it safely. So each nursing home is having to, there's guidance from the state, and the long-term care task force is giving guidance, but each facility is so unique. They're having to kind of come up with their own policies. So please just, work with the facilities and know that they're being asked to do a lot more screening, a lot more moving people around and all this, and congregating people and all this with the same number of staff they've always had. And they were baseline short staffed. And so now it's even a lot more stress on these facilities, but they're really doing the best they can. So I think that's really my update. I'll be available for questions, and I can take questions to the chat, but I think for now that'll be enough.
Thank you, Christian. So we are very happy today to welcome Dr. Joe D'Ambrosio and Chris Pierce as our two speakers to the session. They're going to talk about mental health, and Joe specifically is going to talk about mental health pre and post COVID, and Chris is going to share with us a little bit of his information related to exercise and how that can help and improve our mental health. So just to introduce you quickly, Joe D'Ambrosio is the Director of Wellness at the University of Louisville Trager Institute, and he is an assistant professor at the U of L School of Medicine. He transitioned from a career as a lawyer to social work in 2005 to help individuals find greater happiness and health. He has dedicated his professional career in social work to the study of integrative and collaborative community healthcare service delivery systems. He has over 10 years of experience in training students in behavioral health therapies and interprofessional care models. Dr. D'Ambrosio also researches compassion between individuals and at the community level with the goal of infusing compassion into healthcare systems and interventions. So Joe, you have the floor now.
Okay, well,
welcome.
Thank you, Anne, I appreciate it. And thank you for asking me to speak about mental health, which is an important topic. And my hope is that I don't depress us all or cause any more anxiety than is already out there, because we're not in really good shape when it comes to mental health. So my plan for the next 15 minutes, I'm going to do a lot of talking because I really want to give you a feel for what mental health looked like pre-pandemic, what it looks like during the pandemic, some things we can do, and maybe hear from all of you on how you have taken care of your own mental health during these past number of months. So as you already know, the state of our union in regards to mental health was not good pre-pandemic, and now it's worse. Prior to COVID-19, nearly 1 in 5 US adults, that's 47 million people, reported having a mental illness in the past year, and over 11 million had serious mental illnesses. When you have a serious mental illness, it frequently results in functional impairments and limits your life activities. The prevalence of depression and anxiety was also high. In 2017, 2018, nearly 17 million adults and an additional 3 million adults had a major depressive episode. In 2018, a third of adults reported feeling worried, nervous, anxious on a daily, weekly, or monthly basis. And then you all know about the drug overdoses and the increases that we incurred. Over the past 19 years, it increased threefold. And then add to that, in 2018 alone, 48,000 Americans died by suicide. That's a lot. That's a lot of people. It's 10 million people died of suicide. For older adults, research shows that they are already at risk for poor mental health due to experiences such as loneliness and bereavement. In 2018, an estimated 27% of adults aged 65 and older reported living alone. Additionally, 14% reported feeling depressed on a daily, weekly, or monthly basis, and 23% reported feeling worried, nervous, or anxious on a daily basis. We know that older adults are at risk for depression, and unfortunately, within our medical system, they're many times misdiagnosed or undertreated. And the prevalence of depression increases for those who require home health care or are in a hospital. Suicide ideation is a related mental health risk among older adults. In 2018, older adults accounted for nearly 1 out of 5 suicide deaths. More than 80% of these suicides were among males. White males have the highest suicide rate in the United States. And our concern for children also increases. Existing mental illness among adolescents has been exacerbated by the pandemic with school closures. And what's unfortunate with school closures, children don't have the same access to mental health services that they had when the schools were open. From 2016 to 2018, over 3 million or 12% adolescents aged 12 to 17 or more, that's 1 in 10, had depression or anxiety. Suicidal ideation is also a mental health risk for adolescents. While suicide is the 10th leading cause of deaths in the United States, it's the second leading cause among adolescents aged 12 to 17. When you add to this substance abuse, in 2017, more than 1 in 10 high school students reported using illicit drugs or misusing prescription opioids. This is not a good state of the union. And I could tell you that my golden retriever, who's right down here now, is listening to me and he is pawing me, wanting me to pet him. So I think he has anxiety also. So then we know all this, and then the pandemic occurred. And right now, according to the Kaiser Family Foundation poll, half of Americans report that the coronavirus is harming their mental health. Nearly 1 in 5 Americans say they have had a physical reaction when thinking about the outbreak. A federal emergency SAMHSA's hotline had a 1,000% increase in phone calls. And they had 20,000 people text the hotline in April and May. An online therapy company, Talkspace, which is a major online therapy app, they reported a 65% jump in clients since mid-February. At the Traeger Institute, where we have a behavioral health service organization, I know that just from my own practice, I'm triple booking patients on my days that I do therapy and then stretching them out during the week because we have so much need for mental health and we don't have enough providers. So this is definitely caused by corona-related anxiety. One of the things that people don't understand too is that the ongoing economic devastation is causing mental health issues. They did a study on the Great Recession that began in 2007, and they found that for every percentage point increase in the unemployment rate, there was about 1.6 increase in the suicide rate. According to the American Psychological Association, the economy now is a significant source of stress for 70% of Americans. And what's interesting is, and I know that many will agree with this, the government's response to the crisis is causing 67% of stress for Americans. So recent polling also shows that half of the people who lost income or employment reported negative mental health impact from worry or stress over the coronaviruses. And for those that remained employed, only 50% are comfortable discussing mental health issues. So the long-term psychological consequences of trauma, of collective traumas, can last a decade or more. So I look back through my lifetime, all of the traumas that have occurred. I think about people in my generation, and then the younger generations, like my 22-year-old daughter remembers 9/11. That trauma continues with her today. One study that was done in 2005 in New Orleans, the author called Katrina Brain. And they said that this study showed that mental illness caused by a trauma lasts for up to 10 years. Could last longer if it's not addressed. And let's not forget the effect of this pandemic on parents who, for the first time, had to stay home and educate their children and provide basic needs. So we found that the majority of parents, 70%, saw increased stress versus 44% for non-parents. And then for younger people, the Pew Research Foundation did a study and they found that 1/3 of adults age 18 to 29 are in high distress compared to 15% of adults 65 and older. And think about it. The ideas and creativity of young workers, it's essential for our economic innovation, but right now, many of their lives are on hold. Many of us that are on this Zoom meeting right now saw our kids have no graduation. They have no jobs, and a lot of them have no hope for a future. And then when you look at the healthcare workforce, we all know about the stress that our healthcare workforce went through, starting a pandemic with supply shortages in the United States. It was a shock to so many healthcare workers. We know before the pandemic that nurses and physicians were prone to burnout, and rates of suicide were higher in this population. And the pandemic, although we're trying to support them, it still has had a negative impact on their mental health. So what is this doing to our clients and to us? Fear and worry about our health or our loved ones, our financial situation and job, loss of support services that we relied on. It was difficult to just even go to your doctor. I know that I postponed a lot of medical care that I needed. And we're finding that people long-term are going to see the effects of this pandemic from a physical, biological standpoint. We've experienced changes in sleep and eating patterns. We've had difficulty sleeping or concentrating. Mental health conditions increase in tobacco use, alcohol, and other substances. They reported that alcohol sales increased 243%. And that's not a great way to take care of stress, but it's the way a lot of people handled it. And then what's been really troubling, what I've been seeing in my patients and what they've been talking about, is that this is one pandemic that has scared them because even breathing could kill them. So we're limited, our lives are so changed. We're working from home. We are afraid to go out. When we go out, we have a mask on. Is our mask good enough? And then we see people not wearing a mask. So it's constant fear. If I cough, is that a dry cough? Do I have one of the symptoms? If my stomach's upset, is that one of the symptoms? This is what all of the clients that I'm working with right now are really challenged with, and it's causing an increase in anxiety and in stress. So some of the things that we could do, and I know that a lot of you are already doing these things, and I thought that maybe you could be thinking about sharing some of the ways that you have protected yourself, protected your mental health. But some of the ways is, it's good to keep informed, but it's not good to keep oversaturated with news and information. I've had many of my patients call with severe anxiety, and then when I asked a simple question, I said, so what do you do during the day? Well, I keep CNN on all day, or I keep Fox News on all day. And they just listen to it over and over and over again. This is constant trauma. And then what makes it even worse is, what do we believe? What's the truth? What's not the truth? So be aware of what your daily activities are. Try and have a routine as far as possible, or try and make a new routine. Try and input maybe in the morning mindfulness, even if it's 5 minutes. You can use an app. There are a lot of apps. There's Calm, there's Insight Timer. There's a number of free apps that you can download to do a 5-minute meditation in the morning or a 5-minute meditation at night. Try and go to bed every night at the same time. Keep up with personal hygiene. I know it's been kind of fun not having to dress up, or I could just wear a shirt, and you really don't know if I have shorts on or anything on underneath. I do have pants on, but it's been kind of fun, like just not dressing up every day. But then again, try and get yourself into a regular pattern of what you're doing. Chris is going to be here to talk in a little while about exercise, which is so important. It's difficult to get motivated to do it every day. Try and allot time for working and a time for resting. Try and do things you enjoy if you can. And what I've been really focusing on with my clients is take time for introspection. So when you're feeling anxiety, ask yourself, why am I feeling anxiety? Really look inward. What am I feeling at this moment in time, and why am I feeling it? Take a moment to see if it's real or if it's imagined. We have that fight or flight syndrome that we tend to gravitate towards. But many times probably the things I worried about in life, 99% of them never occurred and never will occur. And I'm sure for all of you, it's the same thing. Try and keep social contact. That's important. Even if your movements are restricted, try and keep contact with people by telephone or the internet or texting. Watch the alcohol and any drug use. If you're playing video games, that's fine, but try and keep a balance. And social media, I know that on your apps such as Instagram, for example, my 22-year-old daughter told me that I needed an intervention on Instagram. So she made me put a timer. So it tells me when I'm on it for a half hour. So it rings, it says I'm on it for a half hour. So it kind of keeps me guided as to what I'm doing. And then as usual, and most of you that are on this are helping other people, try and reach out, try and support healthcare workers, and think about what you have to be grateful for. We do have so much to be grateful for, and focus on that. Even creating a gratitude journal for yourself might be something good. And then for parents, I know this is a stressful time, but try and maintain those routines as possible as you can. And just know that this will morph. It will change into something else. Hopefully we'll have the medical interventions, a vaccine or something that will bring us somewhat back to normal. But this will be lasting. There will be lasting effects of what we feel from this pandemic. If mental health is an issue, try and get to your mental health provider. Talk to a friend. Contact us at the Traeger Institute. We have a full force of mental health providers. We've actually geared up our behavioral health services organization so that we can provide more behavioral health and more care. If you're going to any type of 12-step meetings, AA, SLA, NA, OA, CODA, GA, try and go there, having them online. Some of them now are starting up again in person. When I was looking up this information, I laughed because I saw that there's a Workaholics Anonymous. So I'm going to refer to my Traeger team that I think they should start a Workaholics Anonymous at the Traeger Institute. And we could all start, and this way we could really balance our lives a little better. And then if you're feeling stressed out and you want to talk to somebody, just call us. I've been really successful with texting my clients and them texting me. I find that 5 minutes of texting solves a lot of problems. So it's a different age. In the old days when I was trained, there were strict boundaries. Those boundaries have stretched a little bit now, and it's a lot easier to keep connected, and people just need to know that someone is out there. At one point during this talk, I know that they're going to put up some help lines, the Substance Abuse and Mental Health Services Administration. There's a National Suicide Prevention Hotline, the National Alliance of Mental Health Illness, and the National Institute of Mental Health. So there's different phone numbers. They just put them up online that you can call. I have a lot of my clients that I see, they call these numbers on a weekly basis. And it's people to talk to. It's someone that if you can't get to your mental health provider, at least you can have some support. So I wondered now, before we shift into the exercise part, what have you all done to maintain your mental health? I'd like for all of you to share if you can.
We actually have people on mute. So if you want to be unmuted, just send a note to Justin.
Or you could put it in the chat. You could put it in the chat too.
Yeah. Mona is saying asking for help is not a sign of weakness, but indeed a sign of strength. And Andrea is saying that in the acupuncture world, we have also seen that effectively all of our patients are operating on a higher level of anxiety just as a baseline. We still obviously still focusing on acupuncture and herbal therapies for our patients, but several of them I'm doing guided relaxation exercises, breathing exercises, journaling exercises, and trying to give them as many tools as possible to manage their stress in every breath and every step, so it can extend beyond their actual acupuncture treatments. So that's great guidance from our acupuncturist. Other people are saying, oh, it's jumping up and down. Christian is saying she's playing tennis. Andrea is saying, I'll say something real quick if you like, something that's come up about women's health that I've noticed recently. So Justin, can you unmute Andrea that she can say something? While we wait, Laura is saying she's doing regular exercise, actually more during COVID than prior. That's good. I'm doing less than before COVID. Walk with my dog, meditation and yoga, Justin is saying. VH is saying exercise and yoga. Andrea, you have the floor.
Yes, thank you. Yeah, just something that I've really noticed. So I see mostly women's health patients just at our private clinic right now. And I've seen a huge spike in menstrual irregularities for women who are still having a period, whether it's breakthrough bleeding, more painful periods, more heavy or clotted periods. And usually when we have, kind of like acute abnormalities, it increases the anxiety even more. So I just wanted to kind of just like send out a general message to the women in this group. If you have noticed any menstrual irregularities, first thing is not to panic. It's very normal to skip periods, to have late periods, to have, the breakthrough bleeding. I know if any women were happened to be at any of the protests over the last month and had to be tear gassed, there's a lot of, right now it's all kind of like total data, but they're saying there is a connection between being tear gassed and having breakthrough bleeding. Unfortunately, I've seen a lot of women who have, had early miscarriages in the last couple months as well. So just be extra mindful, kind of pay a little more attention to your menstrual cycle. Don't hesitate to talk to your OBGYN, your midwife, or your healthcare provider about menstrual irregularities. It's very common to see irregularities during times of heightened stress, and just to make sure you're getting the care you need, because especially as women, like our periods unfortunately tend to be kind of like an externalization of our internal mental health in a lot of times. So I know that's not something we normally talk about on these calls, but that's just something that I've just really, really noticed a lot over the last couple of weeks with gosh, probably 80% of my female patients. So
thank you, Andrea. That's good information to have. Darla is saying that after a time of looking inward, I spend time looking upward, embracing my lack of control over any of it. Justin says he watches comedy. That's a good idea, Justin. Essie is saying keeping a routine for eating, sleeping, and limiting media exposure. Stay informed but not overwhelmed. I totally agree with that one. Bobby says, I walk daily. I try to get outside daily when weather permits. I enjoy watching the wildlife in my yard. I read my Bible. I pray. I talk to family and friends. Allison is saying, I go running outside, and she journals. Sam is painting and drawing. Kelly is yoga and weight training in my living room. And then Manahil Khan is saying, taking care of my child, walking and limiting watching the news. Mona enjoying pets. Teresa is saying, I'm taking care of my plants. I'm doing that too. Got a beautiful garden right now. Blair is saying, schedule time with friends on Zoom, including some escapism with gaming and other activities. Patsy is saying, I do hand weights, stretches, 1-minute plank, 6 days a week, 5 hours a week, bicycle here and there. Good golly, Patsy. Keeping this routine has been vital to my mental and physical health. Barbara's doing Tai Chi. Kelly is just thanking Andrea. And then Jennifer is saying, we are enjoying hiking and time with our children. They are the best medicine. My goodness, people, you are all so healthy mentally and otherwise. I am ashamed.
But this is great. It goes to show how a supportive community that comes together, really that's focused on health, can really be healthy. And I think it's, invite somebody with you when you're doing this. Don't do it alone. So if you see somebody in one of these boxes that you think, I'm going to invite somebody, we can come with our mask on. So try and reach out to someone. I think that's the really important part. And what Mona said is that reaching out is probably the most important thing. And I know that people put off going to therapy because it's complicated and they don't want to tell their story, and they may have told their story before. But therapy is like getting in a canoe with a therapist and you're going across a lake. It's not an ocean, it's a lake. And we have many lakes in our lives. So go across the lake, you get on this land that's nice and safe, and you walk a little bit. Then if another lake shows up, you get in the canoe again with the therapist. It's something that should be a lifelong journey so that you can feel fulfilled and your suffering can be reduced. Thank you.
Thank you, Joe. Now I'm going to introduce Chris Pierce. He is an employee at the University of Louisville. He's been working for information technology for the past 13 years. In addition, he's working on a master's degree in exercise physiology, and we are very happy to say that he is an intern at the Traeger Institute, where he is teaching Introduction to Tai Chi classes. He's excited to bring his years of practice and the learning he has acquired to the lifelong wellness community at the Traeger Institute. And I am very welcoming you right now, Chris, and you can share your thoughts with us. We need to unmute him.
There we go. Thank you, Dr. Paul. Thanks for having me here. Wow. I'm not sure how much I can add at this point after reading through all the comments. It looks like everyone here at least is doing a really good job on everything. I'm really impressed by that. Listening to all of the comments and the statistics that Dr. Joe provided, it hit me hard because, you know, it's all very personal, everything that's going on, but when you kind of hear the scope and the range of everything that's happening out there, it increased my stress and anxiety just sitting here listening to things a little bit. So I think the main thing that we can do for ourselves is really just to focus on what we can do, because, you know, I think with all the pandemic that there's an overwhelming feeling of helplessness. So we need to try to focus on the things that we can actually control, which right now is kind of a small amount, and maybe always is a small amount, but what we can control is what we do and how we respond to things. So if we start out just by being a little more active, and that's probably the best thing that we can do in our normal everyday life, outside of pandemics and everything else anyway, is just to get active. And I don't think that people need to definitely have to have a structured exercise program that they have to do. I think if we start small and work our way up, you can, you know, just start with little routines like Dr. Joe was saying. That's a huge thing. So what I like to do is, you know, I'll get up first thing in the morning and I run through a small little warm up routine where I just kind of stretch things out and warm up a little bit. I'll do some Tai Chi, do some push-ups and sit-ups and some squats and things like that, just to kind of get the day moving. And I think if people will just start with little things like that they can manage, you know, you don't have to think, okay, I need to start running. So, all right, I've got to go out and I've got to run a mile, or I've got to run, you know, a marathon or whatever. If we take things in little chunks, make it more manageable, then it's going to be a lot more easy to get into those routines and then to see some kind of beneficial progress and that sort of stuff. So kind of to go along with that, I think it's really good to start with trying to find something that you can enjoy. I don't like running, so I don't do it that much because it's not any fun. Now, I've spent a lot of time walking. I've walked my entire neighborhood many, many times throughout this whole process. I realized somewhere along the way that I still had my father's old bike in my storage closet. So I broke that out and had to do a little repairs on it. You know, I got on YouTube and figured out how to adjust the gears and, you know, replace tires and that kind of stuff. So now to kind of add into that, I've been biking all over my neighborhood, which is, it's a nice change of pace and it's kind of fun to do, and, you know, lets you get out and see people without being close to people. I think that's kind of a nice benefit too. So I've seen and sort of met neighbors that I've lived near for 20 years and, you know, didn't have any idea of who they were or whatever. Now I see the same people every single day as we're going around the neighborhood. You know, they're on that side of the street, I'm on this side of the street, and everybody waves. And it's kind of nice to get you a little bit of the social aspect there that we've kind of lost without being, you know, dangerously close potentially. So, so first, just getting moving. Second, look for something that you enjoy. You know, I'm teaching Tai Chi because I really like Tai Chi, and I want to try to help people with that, try to give that to other people to use as an option. But there's so many things. Online classes, I think, are a great way to deal with the stuff during the pandemic. Like I said, we're doing the Tai Chi classes online, but there's lots of yoga classes online. There's all kinds of fitness classes that you can do online as well. And there's been tons of all of these that have been going up for free over the past couple of months to help people out. And it gives you that social aspect again along with it, especially when you can see the other people, you know, when everyone likes to turn on their cameras and you kind of see the other people there. So it's not just you and a bunch of black boxes kind of working out. That's like working alone. So it's nice to have the cameras and a little extra social aspect there. But again, I don't feel that you have to necessarily do anything specific. In this day and age for us, when we have so much internet and television available, it's easy to sit down and do nothing but binge watch stuff on Netflix or Hulu. I do way too much of that myself, but just to reduce that a tiny bit and to do something, we want to try not to sit for too long, especially like working from home. I've gotten into the point where I'm actually working more and longer than what I did when I was in the office. And there, it's, for some reason, it seems easier to get up and take a break. And that's one thing that we really need to try to work on, is to not sit for too long and make sure you take breaks to be physically active. Some of the recommendations are, you know, no more than an hour or a little bit less at a time for just sitting at the computer or whatever you do without getting up and walking around. That doesn't mean you have to get up and, you know, start working on that marathon training, but, you know, you get up and you take a couple laps around the house, stretch things out, you know, do some twists or something, you know, just whatever to kind of get your blood flowing again and that kind of stuff. If you've got the ability to do like standing desk type of work at home, that's always good. I like to go back and forth when I'm at home or at the office. But if you can find something that you're really interested in, I think that's going to make a huge difference. Someone had mentioned gardening. That's fantastic. And I know if you've done any amount of gardening, you know that's exercise. That's not just sitting there playing in the dirt. That can be some serious work. So try to find something that you're really interested in. My daughter and I started playing pickleball a couple of weeks ago. We've got a park in our neighborhood that has several courts. So we have the option to be there where we're separated from other people with a court between us. So we're not too close to other people, but we're getting something new and exciting in and having fun and getting out. So there's all kinds of good ways to do that, but I think it's really good to try to find something that really interests you. To go along with that, again, I think the virtual environment is really helpful. Even if you don't sign up for classes to take that are structured, someone else mentioned this too, doing Zoom or whatever type of calls with your friends. You can do your own little online workouts in the house or in your yard through your phone or your tablet or your laptop with your group of friends. So that's the social part, I think, is really what so many of us are missing out on. And it becomes really easy to get depressed and just to not feel like doing anything. I understand that as well as anybody. So getting started is that first big step. Whatever you can do to get started, I think is a good thing. And again, doesn't have to be anything fancy, just do something to get going. And if you can have someone to help you with that motivation, if you have someone in the house, that's fantastic. If you can get someone on the phone or through Skype or Zoom or something, that's even better. I've spent a lot of my time here alone, and that's why I go out and do the walking and riding my bike in the neighborhood. But at the same time, I also have my gym that posts their daily workouts on, they do Zoom ones and they do it on Facebook, and I will follow along with those and join in to try to be, part of the group and to help my own motivation. Also the Tai Chi classes, I do Tai Chi on my own, but teaching the classes helps me again with the social aspect. It also helps me with being able to relax. Again, while Dr. Joe was telling us the stats and I started stressing out, I was using some of the breathing techniques that we use in Tai Chi to try to help relax. And just to throw that out for you all, everyone may be familiar with it, but we do what's called diaphragmatic breathing. It's got several names. It's called belly breathing, prenatal breathing, crocodile breathing. Essentially, you breathe down and into your stomach area. Instead of, like when we're running and working out hard, we breathe up. So we breathe up and our weight comes up with us. Well, when you're doing diaphragmatic breathing, when you breathe in, your belly actually expands out. And then when you breathe out, it comes back in. And sort of the beneficial part of this is that it stimulates the vagal nerve, which activates the parasympathetic nervous system. And that's our rest and digest system. It's the opposite of the sympathetic nervous system, which does fight or flight. Fight or flight is where your adrenaline's pumping and everything's all going kind of hard and crazy. And with the parasympathetic nervous system, rest and digest, that's where we get our calming effects, and it helps reduce stress and anxiety. It actually helps to reduce inflammation. It's a very calming thing and lets your system slow down. When you just take that time to sort of focus on your breathing, nice and slow, in through your nose, down into the belly, out through your mouth, it can really kind of help things relax some. It's not a cure-all, nothing is, but anything that we can do to help ourselves calm down and come off of the high anxiety state that we live in, and to be more physically active from all the multitude of benefits that you get from that, it's going to be positive. So that's kind of the main thing for me, is find something that you can enjoy, something's going to help get you moving, and do everything that you can to try to relax. Easy to say, hard to do.
Thank you, Chris. I really appreciate that overview. So someone, let me just say that Andrea was saying she's excited to start the Tai Chi classes. She took her first class yesterday and really enjoyed it. Excited to continue on today. So that's great. Essie is thanking Joe for the presentation. Amy is saying, can any age participate in your Tai Chi program, and how do we connect to it? Chris, you want to respond to that?
Absolutely. That's one of the best things about Tai Chi, is that anybody can do it. It's very adaptable for any level of physical abilities. Some of us have poor balance. Some of us have injuries. Some of us have physical limitations for whatever reason. And no one is precluded from being able to do it. And if we can't do it the way that everybody else does, that's totally fine. And we can help to modify it if needed. But yeah, it's a really great and fun activity. The Traeger Institute does have a web page for it. I believe it's traegerinstitute.com/Tai-Chi, TAI-CHI, if I remember right. Oh, there you go. Thank you, Natalie. Yeah, it's sorry. So yes, definitely. I think it's worthwhile for anyone to try. It's not for everyone. It's, just like anything. Some people are going to like it and some people are going to love it. Some people are going to be like, pass. That's okay. If someone wants to come in and try it out and they don't like it, it's not going to hurt my feelings if they don't. We have an introductory class that we do on Mondays, which I recommend people to start with, because we kind of go over the basics of what Tai Chi is and the postures. And then the Tuesday and Thursday class that we have is sort of our ongoing, where we're learning the 16 movement form. So we're kind of progressing through there. But so it's good to get that intro in first, just so you're not coming in and get totally overwhelmed. So.
Good. That's great information. And you'll know that it is online. This is an online Tai Chi class, so it's not in person. I'm not sure that was mentioned, but just want to make sure everyone knows that. Any other questions anyone has for our two presenters?
This is Christian. I just wanted to say one thing to follow up with what Joe said. I think what you were saying, Joe, it's really just scary, I think, for people to kind of get back into things because, who has the mask on, like some of those examples that you gave, and who does it, and are they 6 feet away and all this stuff. So I'll tell you, the 2 weeks I worked at U of L Hospital, I was a little bit scared about going into U of L Hospital, but then once you get there, everybody's wearing the mask. I have 2 interns, 2 medical students, a resident, me, we're all standing shoulder to shoulder around a patient and examining them. And so, it's like you get mixed messages. We're all standing like shoulder to shoulder taking care of these patients, and we're like passing papers back and forth, and we're all okay. So the big thing is you have to wear your mask and you have to wash your hands. Like I was washing my hands like every 2 seconds, and then I had to go into the COVID unit. And I about like totally had a panic attack. Like, oh my God, I had to wear my face shield and the gown, the whole thing. I go in there, it's like any other unit, like it always used to be. It's like no big deal. Even the nurse wasn't wearing a mask. He had just taken off his mask to take a drink and put it back on. But I'm like, the nurse isn't even wearing a mask. So, it's okay. It's not like COVID is every place all the time. It's like you wear your mask, you wash your hands, and you're okay. Like I run with this woman and she's like, you're telling me our whole economy has been collapsed and all this stuff because people can't wear a mask and wash their hands. It's not that hard. You can still have a normal life. You can still go out and do stuff. You just have to wear a mask and wash your hands, and don't just do a million things every day. Like don't go to work and then go to the grocery and go out to eat and then have a big party and all this stuff. Like do 1 thing a day or 2 things or whatever. But I think there's a lot of anxiety just because you haven't been around it. And I just want you to know, I've been around it. It's okay. You just got to wear your mask and wash your hands. So.
Yeah. And that Christian, what we talked about, that perceived threat where we think there's more of a threat than there really is.
Yeah.
If we're doing everything that we possibly can, we need to also live life.
Yeah.
Because it is very short. I'll share one funny thing that happened to me. I was at Lowe's and I had my mask on, and 3 people that didn't have their mask on, I was trying to buy some screws to fix my deck, and 3 people without masks came around me because they wanted to get to the screws also. And I got nervous, I got scared, and I happened to cough at the same time into my mask. Well, they got frightened with me, so they left and went to lumber. They said, we're going to lumber. We're going to come back to the screws. So I thought this is a good defensive mechanism. If you do feel frightened, cough into your mask. It will separate the crowd from you.
And also, I think people, you forget, like you want to go hug somebody, you want to do something. Like my mother-in-law even came up. I was going to hug her, but then she had her mask on. It made me remember, like, oh my God, I can't hug her. So wearing the mask kind of helps people remember, like, hey, listen, we can't be like hugging and touching and be totally normal. So definitely wear the mask, because it kind of reminds everybody, to proper, use the proper distancing and everything else. So yeah, you're right. You just, yeah, that's a good one. Cough. I like it.
Yeah. So try and I think we have to figure out a new normal. We're never going to go back to the way we were. It's always going to be different. It's never going to go back to the way we are. And we have to become okay with a new normal. I find that even in aging, just the things that I could do in weightlifting or exercise or running, I can't do anymore. And I have to become okay with it. Otherwise, I then get depressed, or I then get anxious trying to push myself beyond the point where I can go. So it's really, how do we accept a new normal? And this is a new normal in our environment.
Yeah.
And I'm glad, you know, Andrea brought up the protest. That's another trauma that we've all experienced. A needed one, I think, but it was still trauma between the pandemic and all the protests and everything that's happening with our government. All of that is really increasing anxiety for all of us. So it's really important that we take that time to take care of ourselves. And when that anxiety is going higher, even if we don't see it in ourselves, look in our family, especially with our kids, look to see how it's affecting our families and our friends, and intervene when you need to.
And I think, you know, the kids are going to be going back to school in the fall. So I think it's good to kind of get into a, you know, start kind of getting out there a little bit, you know, wear your mask, wash your hands, but it's okay to kind of start getting back in the program again, you know?
Well, this was a great session. We really want to thank everyone for their participation. And I really feel very guilty right now for everything that I haven't done to stay healthy. I will start working on it right now. So thank you all for making me feeling so guilty. This is really great. Thank you all.
You're inspired. You're inspired.
Well, guilty, inspired, I don't know. I'll work on those two words. Thank you. Thanks, everyone, and we'll see you all. Oh, I just want to say that next week, Dr. Paul McKinney is going to give us an update about what drugs are being studied for the treatment of COVID, what is proven to work, what looks promising, and what's being done to develop vaccines. We're really looking forward to that session. So we'll see you all next week. Thank you so much.